Hi everyone, my name is Diandro Mota and I will present you my final project of the MTLI course entitled Online Training in Cardiovascular Emergencies, Leaving the Classroom to the Virtual Escape Room. I thank my teaching assistant Ingrid Ataide for the guidance of this project. As we know, in addition to being the leading cause of death in the world, cardiovascular disease is associated with a high level of disability. Healthcare professionals will often face cardiovascular emergencies, making early identification and treatment important to control the global burden of disease. In this context, this course is a new training option for physicians and medical students who are interested in developing skills in cardiovascular emergencies based on strategies that optimize the retention of knowledge in the long-term memory. For this purpose, the course presents a student-centered teaching model in which the main cardiovascular emergencies will be addressed on an online platform over 18 weeks, totaling 5 modules. Students will be divided into groups up to 6 participants who will be supported by a teaching assistant. Each week, a specific topic will be discussed through asynchronous and synchronous activities. On the first day of the school week, students will receive study materials in a web instant messaging application. They should comment on the materials as well as interact and share relevant content on the topic. Such asynchronous activities must be completed before the start of the synchronous activities, which will always be held on the last day of the school week, consisting of 2 stages of 45 minutes each, clinical setting in the virtual escape room, and live lecture. We will detail each of these closing steps. First of all, some considerations about using virtual escape room are important. Escape rooms are known worldwide in the entertainment world. In this game, teams engage in critical thinking to solve puzzles to progress and accomplish a specific goal in a limited amount of time. Its application as a teaching tool in the medical world has been explored for a few years. In general, the strategies contemplate a clinical scenario to be explored within a room, in which not only the patient is present, but also the resource and clues necessary to unveil the tasks. This project proposes to expand the possibility of applying this teaching technique by breaking physical and regional barriers, since it offers an online platform with different scenarios that can be experienced by people from different parts of the world. Through a gamification resource, students will be able to fight together to overcome challenges related to cardiovascular emergencies. Different strategies will be applied to optimize the learning process, such as preparation through storytelling, visual and auditory stimuli, in addition to clinical scenarios that produce low to moderate stress and allow the application of the contents studied during the week. The live lecture will be divided into 3 moments. First, a 15-minute debriefing will take place, in which students will share their experience and difficulties encountered in the virtual escape room. Subsequently, students' doubts will be clarified in an interactive way. Finally, take-home messages will be offered, and the topic of new study week will be present, creating a connection with the content already covered, and in order to arouse the students' curiosity and interest. Finally, we believe that the strategies used in the mentioned asynchronous and synchronous activities will allow the student to have autonomy, find the purpose of learning, and acquire mastery. Students who actively participate in this teaching methodology will be able to recognize and properly manage the main cardiovascular emergencies, use critical thinking in decision-making, act collaboratively, creatively, and conduct positive and effective communication when approaching patients in cardiac emergencies. Formative and summative assessments will be used as extrinsic motivators. Students will be encouraged to develop a group project characterized by the creation of a clinical case in cardiovascular emergency with the potential to be used in an escape room environment. Such a project can receive up to 20 extra points. To achieve approval, students must perform at least 70% and attend at least 75% of lectures. In relation to the course program, 18 topics will be discussed, divided into 5 modules, contemplate, among others, chest pain, arrhythmias, cardiac arrest, and decompensated heart failures, respecting an order that favors the increase of knowledge in progressive levels of complexity. In the week following the last live lecture, students will present the group project. The most outstanding students in the course will receive a certificate of merit recognition, and group projects with good evaluation will be selected for future courses. Thank you for your attention.